With the push of today's society and the increase in popularity of celebrities, people feel the pressure to look their best. The most popular way to keep your body looking young and enhanced is by choosing plastic surgery or Botox. Though these treatments are popular, they are not always affordable or good for your body. Before you decide on either of these cosmetic treatments, you should look into the risks and alternatives of the procedures. The first plastic surgery procedure was performed hundreds of years ago. The original intent wasn't to help a person enhance their looks, but to help them repair a wound or a birthmark. It is believed that the first plastic surgery was performed in 600 BC when a Hindu doctor took a piece of cheek to repair a nose. During this time, cutting off noses and upper lips was a common way of torturing your enemy. Doctors reconstructed noses that were slashed off by swords by taking flaps of skin from the upper arm. Further developments came about in the 19th century when anesthesia became more advanced. Surgeons were able to gain more knowledge because patients were under anesthesia and couldn't feel anything. The Better Baby contest after World War II and the development of motion pictures helped bring plastic surgery into the spotlight. This created a whole new era of plastic surgery. Unlike plastic surgery, Botox has not been around as long. In the 1820s, Dr. Kerner studied a batch of improperly prepared sausages that killed several dozen people. Over a century later, another doctor was asked to examine some food, and she found that botulinum toxin was the cause of the deaths from the sausage incident years before. In the 60s, Dr. Brooks discovered that small doses of botulinum toxin relax a muscle temporarily. In 1989, the FDA approved botulinum toxin type A for treating crossed eyes and muscle spasms in the eye. This is when Botox was born. In the 90s, scientists discovered that Botox temporarily cured excessive sweating and cerebral palsy. Dermatologists also noticed that their patients were wrinkle-free after injecting the drug. In 2002, Botox Cosmetic was officially approved for fixing frown lines, and in 2004, it was approved for temporarily curing underarm sweating. Risks come with every surgical procedure performed. Infection is the most common risk when you are receiving plastic surgery. The area needs to be cleaned properly in order for it to heal. Bleeding could also become a problem if it is excessive and cannot be controlled. Nerve damage or numbness are other factors to consider. Nerves could easily become severed or damaged if the surgeon isn't careful. This is not always a noticeable factor unless it is in the face. With every surgery, there is a chance of a blood clot. These are usually not life-threatening unless they travel to your heart or lungs. Another big factor to consider before you choose plastic surgery is scarring. A surgeon cannot change the way the body will heal, so there will always be a scar. Asymmetry is one of the most common problems when surgeons perform plastic surgery. This is most common in breast augmentation and liposuction in the hips and thighs. Mild asymmetry is considered a normal result. There is always the possibility of complications during surgery, and the worst possible outcome is death. The dangers of surgery do not always include the physical side of things. You need to be mentally prepared for surgery if you are going to change your looks drastically. When surgeries are a success and you are happy with the results, this can boost your self-esteem, but that is not always the case. If you suffer from depression, you need to know that plastic surgery is not going to cure your disease. Teenagers and women go into surgery with high expectations, and when the results are not exactly what they wanted, they can become depressed. Plastic surgery and Botox can bring rewards, but they will not change your life, your problems, or your relationships. Plenty of young women suffer from depression because they have numerous surgeries and they still cannot achieve physical perfection. Plastic surgery is not always the best option when it comes to changing your looks. It can be very expensive and dangerous. If you are looking at a facelift, you could use alternative creams to soften lines around your face. A retinoid cream can help soften lines around your eyes and your forehead. Another alternative for a facelift is the CACI. CACI stands for Computer Aided Cosmetology Instrument. It is just a machine that uses electrical currents to stimulate lost muscle. If you offer this treatment, you will need to be treated 10 different times. There are plenty of other common things you could do instead of receiving plastic surgery. For instance, instead of getting breast implants, you just need to buy a padded bra. Exercise is also an option. If you exercise, you can build muscle tone and tighten skin without plastic surgery. Botox is one of the most popular procedures in the United States. but there are a few other popular alternatives. Fillers are almost the same as Botox, but they are a better alternative for treating nose-to-mouth wrinkles. They are proven to last longer than Botox treatment, but they still only last a few months. Another alternative to Botox is chemical peels. Chemical peels reduce the appearance of line and wrinkles on the face. They can also smooth scars and uneven skin tone. When you receive a chemical peel, they will apply an acid solution to your skin, which causes injury and gradual peeling away of the top layers of skin. Superficial peels only last around 2 months. Laser resurfacing is the final alternative to Botox. Laser resurfacing is just like a chemical peel, except they will use high-energy beams of light instead of acid. Laser resurfacing will remove more layers of skin than a chemical peel. It will take over a week to recover from this procedure, and the results are long-term as long as you don't damage your skin again. Society's image of a perfect body is not always the case for most women. Plastic surgery and Botox will always be an option if you decide you want to change, but everyone should feel good in their own skin. I think it is about time society starts portraying a more reasonable image so more women won't feel the pressure of having to put themselves in risky procedures just to fit in.